Current vaccination approach focuses on post-exposure prophylaxis or PEP of close contacts of Mpox cases, as they are the highest risk for developing infection. A single dose of the Genius vaccine will be offered and should be given within 14 days from the time of exposure. For healthcare workers, personal protective equipment or PPE, together with infection control protocols, remains the key mode of prevention. Nevertheless, to further protect our healthcare workers who are at the highest risk of exposure to confirmed Mpox Clade 1 cases, such as those working in NCID or other designated healthcare facilities who need to render direct care for these patients and to be in very close contact with infected cases, we are offering pre-exposure prophylaxis or PREP to them. Our current understanding of the disease characteristics and how it transmits. This is very different from COVID-19, where the dominant form of transmission is through the airborne route. Yeah. In contrast, for the Mpox, it is mainly through contact, either with the skin of infected cases or contaminated surfaces after secretions from these infected cases have landed on those surfaces. On the basis of what we know, the risk is highest in those who are actually taking direct care of these people in the hospital and healthcare setting. So we do not at this time have any plans to vaccinate a larger pool of people beyond what I've just described, but we will continue to monitor the situation as our understanding of how transmission takes place. We will evolve and adjust our plans for vaccination accordingly.
If we start offering vaccines to everyone that we think is vulnerable, first, I don't think there will be enough supply. No country will have enough supply for smallpox vaccine to do that. But I think it's not effective. You are somewhat wasting the vaccine, given that this is a R1.3, right? And you'll be giving to so many, not enough, and it's not effective. I would say this is 事倍功半，浪费了那个疫苗。Instead, we save it for those who have exposure. Yeah, so we contact trace, quarantine them, give them as a PEP. Yeah, and therefore, hopefully they won't develop symptoms, they won't get infected, and that way we suppress the R, hopefully below 1. Then overall, we are fighting the war much more smartly, and that way is 事半功倍. Yeah, it's much more efficient, more effective for us to use the vaccines that way. Yeah. So in case everybody going away thinking that this is a matter of supply, yes, supply will be an issue if you want to give to everybody. But based on the characteristics, based on the strategy, I think this is the right way to do it.